Vascular Ehlers-Danlos syndrome by Marina Foulk. Vascular Ehlers-Danlos syndrome, or type 4 EDS, is a rare genetic disorder that can be life-threatening. It is caused by mutations in the COL3A1 gene, which holds the instructions for the synthesis of type 3 collagen. Vascular EDS follows the autosomal dominant inheritance pattern. Since it is dominant, one copy of the mutant gene is sufficient in causing the disease. People with vascular EDS will typically be heterozygous for the COL3A1 gene, meaning they have one dominant mutated copy and one recessive non-mutated copy. Vascular EDS may be inherited from an affected parent or the result of a de novo mutation in an unaffected parent's egg or sperm. This image displays the autosomal dominant inheritance pattern of vascular EDS. With one affected parent and one unaffected parent, there is a 50% chance their child will be affected. The affected parent is heterozygous for COL3A1. COL3A1 is a protein encoding gene, and it carries the instructions to produce the alpha-1 chain in type 3 collagen. The gene locus is 2q32.2. This means that it is located on chromosome 2's long arm in region 3, band 2, subband 2. In the image, the gene locus is indicated by the orange arrow. COL3A1 is made up of 51 exons that extend across 44 kilobases of DNA. Mutations in the gene impact the production and function of type 3 collagen. Over 500 of these mutations are associated with vascular EDS. Type 3 collagen is a homotrimer that is made up of 3 identical alpha-1 chains, which are encoded by COL3A1. These chains are bound into a triple helix by disulfide bridges. Each chain is made up of 1,466 amino acids, with glycine occurring as every third amino acid. This is called the GlyXY sequence. Type 3 collagen is a secreted protein. After assembly, this molecule is transported outside the cell to be modified and to carry out its function. Collagen is typically very rigid and non-flexible. This is due to the heavy presence of glycine in the alpha-1 chains. Glycine has only hydrogen in its side chain, making it the smallest amino acid. With glycine so frequently occurring, the alpha-1 chains can form a very tight and strong triple helical structure. Due to this rigidity, type 3 collagen functions in supporting connective tissue, and it is also found as a structural component of hollow organs like the uterus, bowel, and blood vessels. Normal type 3 collagen molecules will appear as displayed in this image. The 3 helical alpha-1 chains join and create a triple helix. Mutations or variants in COL3A1 cause vascular EDS. Most of these variants involve missense mutations, or DNA-based substitutions that cause a change in the encoded amino acid. Here, glycine in the GlyXY region is replaced. In this image, the structure of type 3 collagen is broken down. In the middle, it shows how each individual alpha-1 chain is a helix, made up of repeating glycine XY sequences. The blue circles of glycine make up the backbone of the alpha-1 chain. So, when glycine is replaced with another amino acid, the structure and function of the molecule are greatly affected. A smaller number of mutations arise due to other reasons. Some variant gene products are the result of exon skipping, in which certain exons are not translated. Others occur at exon-intron junctions, where an exon may be partially removed or an intron may not be removed during mRNA processing. Very rarely, variant gene products are the consequence of partial gene deletion or nonsense mutations. When COL3A1 is mutated, the functionality of type 3 collagen is impacted. With glycine replaced by a larger amino acid, the alpha-1 chains cannot join in such a tight triple helix. With that tightness lost, the collagen molecules are stretchy, not rigid like they're supposed to be. This rigidity is necessary in enabling the collagen to function in support. Alterations in structure also cause decreased secretion of the molecules into the extracellular matrix. To be modified into mature collagen, the pro-collagen molecules must be processed by extracellular enzymes. With less secretion, collagen cannot be modified or fulfill its extracellular function of support. In summary, when there is a missense mutation encoded in the COL3A1 gene, the mRNA transcript will hold codons that no longer code for glycine. When this mRNA is translated into the alpha-1 chain protein, the amino acid sequence will be different than in a non-mutated gene product. Now, the structure of the alpha-1 chains and type 3 collagen triple helix is flawed. Proper structure is critical in enabling the protein to function correctly. This type 3 collagen, due to the mutation, has lost its functional rigidity and therefore causes the manifestation of vascular EDS symptoms. Vascular EDS symptoms are the result of the loss of rigidity in type 3 collagen due to a COL3A1 mutation. One symptom is uterine rupture. Impaired type 3 collagen can cause the walls of the uterus to be significantly weaker, and during pregnancy, this can lead to tears or ruptures. Similarly, improper type 3 collagen in the bowel can cause perforation or rupture. Also, mutated type 3 collagen in arteries can result in tears or aneurysms, which can then cause internal bleeding. Another symptom is pneumothorax or collapsed lungs. Partial lung collapse is a very common effect of altered type 3 collagen in the lungs, and it is often the first vascular EDS symptom that manifests. Varicose veins are also a symptom. These bulging veins are caused by non-rigid type 3 collagen in blood vessels. Lastly, vascular EDS patients may experience slow wound healing. Type 3 collagen is used during healing and blood clotting, so these mutations can cause delays in healing. There is no overall treatment for vascular EDS. However, certain symptom manifestations can be treated. Surgery can be done to repair a ruptured uterus, bowel, or artery. These procedures are most successful when surgeons know of the patient's diagnosis and are cautious of their delicate tissues. For ruptured bowels, timely surgical intervention is critical in decreasing infection severity and restoring proper bowel function to the patient. A great resource for vascular EDS patients is genetic counseling. Genetic counselors can use testing to determine the specific cause of someone's vascular EDS. They can also calculate the probability of a couple having affected children, and they can educate patients about vascular EDS and its inheritance. In conclusion, vascular EDS is an autosomal dominant disorder. It is caused by mutations in the COL3A1 gene, which codes for the alpha-1 chains that form the type 3 collagen triple helix. Most of these mutations are missense mutations that cause glycine to be replaced by another amino acid in these alpha-1 chains. This results in type 3 collagen losing its functional rigidity and the consequent development of vascular EDS. These individuals who are heterozygous for COL3A1 and therefore produce defective type 3 collagen may experience various symptoms, including uterine rupture, bowel perforation, arterial fragility, pneumothorax, varicose veins, and slow healing. Although there is no overall treatment, some symptoms can be treated surgically. Lastly, genetic counseling can be very informative for those with vascular Ehlers-Danlos syndrome.